As I've mentioned, we have what's called a U.S. Multiple Myeloma CAR-T Consortium. Moffitt is the coordinating site. This is essentially data collection from about 15 to 18 institutions, some of the major institutions treating patients with multiple myeloma, not only with CAR-T, but also bispecifics, T-cell engagers, essentially. And we are gathering data in real time in patients receiving CAR T cell therapies and bispecifics, and we're putting out there some information about, real world patients. So patients who are being treated outside the confines of the clinical trial. I do feel this data will be very beneficial. Like I said, for ID-cell or Abecma, we've seen 75%, so three-fourths of our patient population, which was 159 patients we looked at, with the trial having 128 across different centers in the United States, we saw that, this product is efficacious despite most patients not meeting trial eligibility criteria. It was safe, it was efficacious, we can give it. We also will be presenting cell-to-cell data, so I think these are not head-to-head comparisons, but it's nice to see not the perfect patients, because in the real world, we have patients who have plasma cell leukemia, we have patients who have amyloid, we have patients who have renal failure. So we have some patients that may not have been eligible for the trial, and we're giving these. So how will these patients do? So we'll be presenting a lot of this data. It's very exciting, and it's just led to a lot of collaborations among the different institutions, as I mentioned, across the country. Other studies that we are that I'm currently working on. So currently working with Bristol Myers Squibb as well as Janssen, looking at some possible models that help us predict, including patient characteristics, so like clinical information about the disease, like high-risk disease, prior treatment history, but also some biologic information, so looking at blood samples, bone marrow samples, PET scans to identify who are the patients at greatest risk for treatment failure, treatment benefit, or increased risk for developing toxicity, and more so the higher grade toxicity. And really, the goal would be how do we improve upon these things? So we were just at Tandem 23, and there I had a very small project where we looked at what are some inflammatory markers that may predict for toxicity response. So what we found was, baseline. So having elevated baseline ferritin, which is an inflammatory marker, and having another cytokine, another type of inflammatory marker called interleukin-6, we saw that those patients had an increased risk for developing higher grade toxicity called cytokine release syndrome, and they had an inferior progression-free survival. So certainly, these models will help us identify, who are the patients at highest risk and what can we do to kind of we need to really tailor the treatment for toxicity and for, additional therapy to mitigate, morbidity, mortality, to make sure our patients get the most benefit. Other studies we are looking at are, one of them is a quality of life study. I'm working along with Dr. Laura Oswald, Dr. Lauren Perez. We are looking at disparities in patients treated with CAR-T. So we will have some data come out, hopefully in the next few months, looking at outcomes by race and ethnicity in patients receiving CAR-T. And we also will have hopefully some information in the next few months coming out, looking at patient-reported outcomes. So what is the patient's experience post-CAR-T? Are they feeling better? How do they perceive their treatment? This is some very exciting data that will come out in the next few months regarding patient quality of life with CAR-T and bispecific therapies. From the Myeloma Consortium, we will have two projects coming out at ASCO. So one of them will be the real-world outcomes in patients receiving CARVYKTI with a short follow-up. And the second one will be the impact of bridging chemotherapy in patients receiving CAR-T. So like the treatment you get prior to CAR-T to kind of debulk the disease, lower the disease burden as much as you can, to see what may be some of the more impactful treatments to help improve the outcomes. And we'll have some data come out on patient and caregiver burden regarding transplant, not necessarily CAR-T. but at ASCO. The rest of it are manuscripts that are written and will be submitted in the coming weeks.